everyone. I'm Avery Sweat, Associate Editor at Levin Associates, where we track healthcare M&A trends, deal data, valuations, and sector intelligence across a wide variety of seniors housing and healthcare sectors. Today, I'm joined by Shawn Janus, National Director of Healthcare at Colliers, and Marianne Skorupski, Director of National Office Research at Colliers. Thank you so much for joining me today, Shawn and Marianne.
Thank you.
Great. So you guys are hosting Colliers 2026 National Healthcare Conference in Boston this year. I'd like to start off by asking you both about the event itself. Who is the target audience for this event, and what do you hope attendees will take away from it? Shawn, let's start with you.
Yeah, so it's really become. I'm proud of the fact that I think our NHC conference has become one of the must-attend events in healthcare real estate. BOMA MOB is the largest one without question in our space, but I think we're kind of widely recognized as number 2 and number 3 now in terms of folks that have to be there and attend and do all those good things, which is awesome. In terms of a target audience, I would say we try to keep our conference actually much smaller than a BOMA, because we want to make it, I don't say an intimate affair, but it's somewhere where people can actually network, have time, form relationships, be able to interact as well. And then we had I put our attendees kind of into 3 buckets. One is some of the Colliers folks obviously attend that. So some of our top healthcare brokers and such around the country will attend. But then more importantly, we have our provider clients and prospects. So whether they be health systems, hospitals, or physician groups who attend. And then we have the investor developer community. There's some consultants thrown in there as well. So it's kind of that full spectrum of folks who are participating in healthcare real estate. And our aim is to really provide them with thought leadership, expert insights, give them access to kind of those individuals and their knowledge base so they can learn from that. But I would say as importantly, it's also the opportunity to network and form relationships. I'm sure we'll touch on it a little bit later as well. But as the industry has matured and gone forward, and particularly given some of the tumult that's currently going on economically and otherwise, folks are gravitating toward individuals and firms that they know well and have relationships with. So this is an opportunity to either cement those or to form new relationships and really enhance that.
Also, Marianne, I'll throw the question to you as well. What do you hope attendees will take away?
I think, as Shawn mentioned, the opportunity for connection is really important because everybody's so busy and running in multiple directions, and there's constantly changing information and insights out in the marketplace on a daily basis, that coming together in person when everybody is spread out, whether it's, a client, a Colliers professional, or anywhere in between, we're spread across the country. So to have the ability to be together in a smaller venue setting than a BOMA or some of the other larger industry conferences really gives meaning and value to those interactions. And so we do have a lot of client meetings that will be held off-site, which is great because, again, you're taking that opportunity to attend a session, but also have your client meeting. But the insights provided through the panels, and then we introduced last year for the first time, which personally I am excited about again this time, is a little bit of a women's networking session. So that women in healthcare who are coming together again from this 3 different buckets of attendees really just creates another small group opportunity to meet each other, create that connection, create valuable leads or insights that maybe you didn't have prior to coming together. So, I think that's an excellent opportunity for our attendees as well.
Awesome. Yeah, it definitely sounds like something our audience would be interested in. It's hard to find those kinds of intimate meetings that foster those kinds of conversations. So I'd like to, while we're on the conversation, get a better sense of what the actual conversations will look like once people are there. So what type of topics do you think will be at the forefront at the conference this year? And what do you think will dominate conversations in the hallways and at the sessions during it? Marianne, I'll start with you.
Okay. I think, one of the big things right now is just some of the policy changes that have been happening. We do have a couple of panels that will be talking through this. And so it's just trying to understand what those impacts are. And I think you're going to have a lot of our clients who will be talking to each other about how they're incorporating those changes or adjusting to those changes, as well as then, the other conversations are related to facilities and strategies for adapting in the environment, right? So while each health system or provider practice will have its own unique focus, there's going to be commonalities about approaching that. And so, you'll see some of that. There's conversations being held and working with our Colliers professionals for how we can help them and partner with them on those efforts, especially as that might relate to physical real estate and how we might be able to help with either acquisition, disposition, or anything in between, whether it's construction improvements or anything else. So I think you're going to see a lot of those conversations right now, just kind of dominating the top of mind to-do items, if you will, for a lot of our clients and prospects.
Awesome. And Shawn,
what do you think?
Yeah, go ahead.
I was gonna say, Marianne covered that nicely. Kind of the way it's structured, the conference really is to give a background. We have three what I'll call keynote speakers. One is who are our national head of research at Colliers, who will talk more globally about macroeconomics, what's going on from the U.S. economy perspective, so you get a sense of that. And we have Obo Insights, who will talk about the healthcare industry and what are those things in the healthcare industry that are driving providers to make decisions. How does that impact investors, developers? And then we also have our third keynote, which is Hall Render, one of the foremost real estate healthcare legal firms in the country, will be talking about transactions. So how does that then come to that side of the business, which is, again, we're on the healthcare real estate side, so we put all those things together. So I think that's one of our goals, is to really bridge that gap, to kind of start at the macro level, talk about the healthcare industry, and then get to healthcare real estate. And to Marianne's point, we then have two panels. One is a provider panel. We have some of the foremost health system executives around the country who will talk about what's impacting both their institutions, and then how does that then relate to strategy. And real estate obviously is a huge portion of their balance sheet, a big operational cost right behind their HR personnel costs. And so that's very important as well. And the investor developers are trying to figure out how to best service that client group. So I think those, as you look at all those things, some of the specific things I think we'll be getting into, not surprisingly, is really kind of inflation and what's going on relative to the Fed and Kevin Warsh, and what is all that going to mean? And he's trying to change things up quite a bit, which creates a lot of uncertainty in the marketplace. That's not necessarily a bad thing, but it is something that has to be dealt with. Then you also have obviously what's going on with the Iran war, and depending, one day to the next, how is that affecting what's going on to an interest rate environment? Because that's critical from a real estate perspective, obviously, whether you're financing it through tax-exempt bond financing, you also have investors, developers who are using third-party investing as well. And the other topic, which overlays everything, and you can't get away from it over the last year plus probably, and that's AI, and how does that interface to all of this? And is that affecting the providers, and what are they doing? Is it still really more related to kind of back office and being more efficient there? Or are we now finally getting to the point where AI can be utilized more from a diagnostic perspective, really getting more into the clinical elements? So I think those, kind of those two major themes or elements, kind of the inflation economy, and then kind of what's AI doing, will dominate the.
Great. Well, those are all very important conversations, especially right now in our environment. Now, I'd like to shift the conversation. We'll get back to the conference, but I'd like to talk a little bit about what you've been seeing in the broader deal environment so far this year. What's been the most surprising or encouraging development in healthcare M&A so far in 2026 for you, Shawn?
But that's an interesting question. I would say, it maybe not surprising, only because we're eternal optimists in real estate. But I do think activity has remained strong. We kind of went into the latter part of 2025 and saw some more robust activity. And I say that really in the context of what we were just talking about, as relates to the economic environment, and inflation, and interest rates, and decision making. I mean, oftentimes I've been in the healthcare real estate space for longer than maybe I care to admit sometimes, but through all of that time, decision making in the healthcare industry has been much slower than it has been in more typical commercial endeavors. So it always seems like we're a few years behind, or they have to get a consensus, particularly in academic medical center. We have a lot of different constituencies, et cetera. But I will say that's been an interesting piece of that. We're actually seeing there's been a lot of activity in kind of the core and core plus, medical outpatient building arena, which is well publicized. Now you guys cover that very well as well. But I think the encouraging things, we've seen a broadening of entrants, and some of those are entrants who had been involved before and had kind of stepped away during some of that uncertainty, but they're coming back into that market. So we're seeing that broaden a bit, which is great. So it's not just the Montecito's and the Remedies and some of the players who are consistently at the top of the list. We're now seeing some of those other folks, and we continue to see new formation of capital as well, in terms of partnering with established players, or just trying to get into the U.S. market as well. So we're seeing quite a bit of that. And then the other piece of it, I guess, is on the provider side, with some of the tumult that's happened in the industry with some of the REITs and some of the publicized things. There have been opportunities for providers to potentially buy back some of their key assets in medical outpatient buildings, et cetera. So we've seen some activity there, and I think we'll look forward to that continuing.
Great, Marianne.
I think the only thing I would add, since Shawn covered it pretty well, is just that the fundamentals still make the healthcare sector still really attractive. And so while we might see those ebbs and flows that you might see in general with the M&A activity or across all industries, the stability for healthcare is what is attracting and kind of helping that rebound or that increase jump up a little quicker than we might see in some of our other, especially real estate sectors. And so I think that's not to be lost in the conversation too.
Absolutely. Well, for the next question, I'll throw this to Marianne. We've talked about the more positives. I like to focus more on the negatives for this next question. So what are the main challenges or headwinds still making deal making difficult right now?
Well, I think as Shawn mentioned, some of the economic instability or uncertainty, right? You have actually both sides of those pieces happening right now can make some of the number crunching just a little bit more difficult. And so for folks or institutions that are maybe coming back in, there's just a little bit more understanding they need to have to make it, gut check and really work out for what they need. And I think that that has been just a little bit more challenging, really. It's just made it an extra step or an extra 3 steps that hadn't been there. But, I do think for better or worse, we've been kind of in this uncertain environment for a few years. We just have maybe some new nuances or a couple new levels to add to the environment. So I think there's a little bit of comfort with the uncertainty, but some of the rate increases recently are making things just that much more difficult. Again, when you're looking at where the investments should be or how involved or what a partnership percentage might look like. And so I think those are some pieces that are really making it difficult right now.
And Shawn?
Yeah, I would agree. And Marianne made some great points, not just then, but earlier also in talking about some of the fundamentals, the underwriting. Because what that has done, it kind of gets to some of the providers wanting to maybe own their real estate, et cetera. And they're looking at it and saying, well, we know we need to do this. We think there'll be a cost benefit to doing this. Our cost of capital may be cheaper than, tax-exempt bond financing than what the investors may get in the marketplace. But there's a juxtaposition with that as it relates to the constraints on their capital. I mean, healthcare has always been a voracious user of capital, and parceling that out. Where does real estate fit into that? I think we're seeing more and more of the strategy and what real estate can afford relative to accessing some capital out of real estate and redeploying it, whether it be into other areas or into more critical real estate areas as well. But Marianne touched on that. Well, the one thing I will say, and again, it is, I think, inflation, the economy, all those things that she said are extremely important drivers right now. But as I said before, so there's a lot of uncertainty. It seems like there's always been uncertainty that's come from one area or another in this business.
Right.
I've always said that, uncertainty obviously creates challenges. But I do think that challenges then also present opportunities. and how can you best
Absolutely.
coalesce around that, have the right strategy to drive what's your mission and your organizational goals, and how can real estate, in our case, support and really help to deliver on those.
Absolutely. I mean, on our end, we saw it in the 2021 era when there was probably the most uncertainty. We saw the most deals. So there is
Yep.
definitely some truth to that. Now I'd like to stay on this deal making theme and ask you guys, what is it going to take for M&A activity to reach those record-setting levels that we saw in 2021 again? I'll throw it to Marianne. Oh, or Shawn.
I was gonna say, let Shawn have that one.
Yeah. I can start, and you can jump in if you want, Marianne. But I think, and I think we would all like to have the magic wand to be able to know exactly what it is that's going to cause that to happen. But I do think, and we've kind of, I want to say harped on it, but we have talked quite a bit about uncertainty, and to
Yeah.
the extent that greater certainty around what's going on from a macro environment and a policy perspective, as Mary had mentioned earlier. What are those things, and how is that going to impact Medicare, Medicaid, reimbursements, all of those different things that the providers are wrestling with, and obviously the investor community is trying to underwrite and understand as well. So I think just getting more certainty around that. I think the industry over the years has done a better and better job about making quicker decisions as they've gotten some of that information. And the longer you wait, I'm going to say dawdle is probably not a great word to use, but overanalyze it, but really understand what are those drivers, and kind of at least have somewhat of a roadmap and be able to make decisions based upon that.
So, Marianne, what do you think is going to bring the resurgence?
I think once we fully understand this new environment with some of the policy changes, right? So they've been enacted. We're still seeing some rollouts and effective dates of some of the changes. And so once everybody fully understands what that trickle down effect is going to look like in reality, instead of just, well, I think it might do this, or it looks like it could do that. I think there'll be opportunities, again, as we talked about strategic efforts, right? So I think with 2021, we saw a lot of opportunities for systems that weren't in different buckets or different types of buckets to get into those, right? The pandemic kind of opened up some opportunities. And I think, as Shawn mentioned, the challenges that someone has could be an opportunity for another system or a provider practice. And so we've seen that shift. And I think the outpatient growth in some of these outpatient buildings, whether they are freestanding EDs or urgent care or a general practitioner or whatever that case might look like, there's now some opportunities to see how they fit into systems, into different systems, or align with a system that maybe they've been an unaffiliated practice before. And so I think you'll see, again, where is the missing puzzle piece and how do we fit it into our puzzle? And I think that's going to start to happen with a little bit more knowledge and strategic effort for that piece. And I think systems are realizing that there are opportunities in various strategic ways. It's not just one way or another, that there's multiple avenues to achieve the goal. And I think that's what's going to start to help with that M&A activity to increase again, as I said, the knowledge of policy implications, comfort with the environment, the economic environment we're in, and then realizing where the puzzle pieces and how to get strategic and the creative opportunities for that M&A.
Right.
Just adding on to that quickly is, as Marianne was saying, I think we've been fortunate enough to create 2026 has been a banner year for Colliers Healthcare Real Estate, which has been great. But one of the drivers of that this year has been portfolio optimizations. We had a recent, we do quarterly research publications. I think we just did one on portfolio optimization. I think this was one of the better received ones in the marketplace. I think that kind of gets at the same thing. So folks are saying, hey, you're the experts. Help us really look at how do we best optimize, given what's going on, in policy, in the macro environment. How does that relate to our portfolio? And there's a lot of outcomes that come from that. That could be expanding, could be consolidation, could be divesting. In some cases, it's like, are there particular specialties we haven't been involved in? What are the hot areas? Behavioral health, seniors housing, home health care, getting back to some of the demographic stuff that Marianne had mentioned. So I think those are some of the things that you do all that again helps drive M&A activity as folks divvy up and figure out the best strategy and how to execute that.
Absolutely. And as you mentioned, Colliers has a wide view across different healthcare services and outpatient segments. So I'm curious which area you think is currently not getting the attention it should from investors, and which segment do you think is maybe flying under the radar, the one that smart investors should be paying a lot more attention to, and why? I'll throw that question to Marianne first.
Oh, goodness. I do think that, I don't know if it's necessarily flying under the radar, but I think there are maybe opportunities that most, lay people are not aware of when it comes to our senior community. So our 65 plus community. I think that sector is and healthcare provider realm is growing so substantially because the patient population is growing. So I think there is a lot of opportunity with the geriatric services to look at how AI is being incorporated to provide services to homebound seniors, or what opportunities to make that a smoother patient visit for a population that needs multiple services in one visit. And I think there's opportunities there to really kind of make that grow. And that's where we're also starting to see, just in general, with the venture capital funding that's coming into the sector on a larger scale, with allowing provider practices to kind of reimagine or increase their options for services. And that's, I think, one of the sectors that I think will see some growth.
Interesting. Shawn,
what else are you seeing?
What do you think?
I think that was a great response. Interesting, as you posed the question, Avery, it was like, kind of what is flying under the radar, or is it? And I've been in the space for a while. Even 5 years ago, if you asked that question, I think there would be not a litany, but there'd be some more specific examples. I think it's a testament to the industry that the industry has evolved. You do have much more sophisticated investor developers and much more sophisticated providers as it relates to the healthcare component of that. So I think some of those things which you before would say, well, it's under the radar, we need to help them get there. I think they're aware of those things now. So there's less maybe that is under the radar. Marianne mentioned too that I had mentioned earlier as well, kind of the behavioral health component, and then the seniors, whether that be the assisted living or the home health care and some of those other drivers. The other piece is, it's not under the radar, but affects real estate is a bit of the AI and kind of robotics. We get more the clinical element versus the back office, and how you need to configure space in order to be able to bring those types of newer technologies to have be able to do that in confined spaces such as a medical outpatient building or even in the hospital itself. So I think that has created some folks are aware of that, and obviously one of our jobs is to help them have more concrete strategies as it relates to the real estate component of that as they look at it from an overall objective.
Great. Now I'd like to shift back to talking about the conference programming for a minute. You're putting together a very strong lineup of panels this year. So I'd like to ask, what panels are you most looking forward to? And if you could get on the mic to ask one question, what would it be to the panelists giving that panel? I'll start with Shawn.
Well, I think being the sponsor of the conference, I think every panel and keynote speaker is just as riveting as the others. So
good answer.
Yeah, but I would say, for me, I'm obviously immersed in healthcare, real estate, all day, every day, 24/7, 365. It seems like.
Yeah.
But a lot of that is obviously healthcare related. So we need to have, as I always tell. We have our healthcare fellows, our creme de la creme of the healthcare brokers in our firm, as well as our other healthcare folks, that they really need to understand what's going on in the healthcare industry. So I always do look forward to, when OBO Healthcare Insights does their industry update, talk about policy and what's coming down, what has been influencing the industry per se. And then again, our job is to translate that going down. But I always look forward to that one in particular, only because that's a bit broader perspective. We always have some knowledge of that. We'll never have the same depth of understanding that our provider clients will. They live and breathe that every day. But we do need to understand that. So I do always look forward to all of them, but that one in particular is one that always holds my interest.
Yeah, absolutely. Very important. Marianne?
I always find the provider panel really interesting. Honestly, at any conference that I go to, and so I know it's not any different with this one, because you feel like you're the fly on the wall, even though you're amongst several hundred people sitting in a conference room. But you feel like you're the fly on the wall listening to this conversation that you're not normally privy to, because they're sharing information together that really shapes what they're doing. And it's interesting when you can sit there and watch them actually have a very organic interaction about what they're sharing with each other. And they're like, oh, wait, I did that too. Or we ran into the same issue and we did this. And you're just like, oh my gosh, there's the light bulb that just went on. And so it's pretty phenomenal to have them around the table. You don't normally get the opportunity to have multiple systems and at a table together, and we're usually doing one-offs and then kind of bringing that insight into the middle. And so I think the provider panel is my favorite. I find it just that much more detail, like truly into their minds of what they're thinking with their everyday activities.
And Marianne and I we're both biting our tongues. You asked about the panels and the keynotes, but if you were to be honest, it's probably the reception that we host. Whenever it has a cocktail.
I didn't think that was an option. It's not officially called
that
a
is
panel.
actually one of my favorite. Not because
that was my next question.
But it is, you get that atmosphere where it's I want to say less guarded, but it's just more of a relaxed atmosphere, and have those kind of get to know people's background.
Absolutely.
And yeah, so that's always a big part of it as well.
Yeah, that's when the real conversations happen. Yeah. The most fruitful ones.
You sent over the question about, what's your single tip that you'd provide to the attendees. And I think
actually that's great. That's my next question.
Well, then here, softball, hitting it out of the park here. I think it's the receptions, right? Talk to somebody you don't know, because you get more insight and more value than what you walked in with. Absolutely. And I think that's the biggest thing really for any conference. But again, with this being a little bit more intimate, the value I feel like is maximized. Mm-hmm. And you can bond over being in a cool city. And we do, I think, fun things and fun venues for our receptions that just give an easy way to break the ice.
And Boston is beautiful that time of year.
It's their brother that's standing next to them. We don't know if it's their brother or their husband. So
right,
it's true. True.
And it's usually a small world where multiple people in common, and you're like, oh, I didn't know. Oh, I know so and so, and it again
worlds
makes
collide,
it sticky, right? And then then you do business at some point, and it's great.
Yeah. Well, awesome. Thank you so much for sitting down with me today. This has been a great conversation. Thank you for providing insight into this conference, which will take place in Boston on October 8th through the 9th. If you'd like more information about the Colliers 2026 National Healthcare Conference, check out the links in the description below, and we'll have a little description about it as well below. Thank you so much for taking the time to talk with me today, guys.
Appreciate it. Thank you so much.
Thank you. It's been a pleasure.
Have a great day.
You too. Bye.